You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS members Joan Such Lockhart, Professor and Director of the MSN Nursing Education Program at Duquesne University School of Nursing in Pittsburgh, PA, and member of the Greater Pittsburgh ONS Chapter, and Melinda Oberleitner, Dean at the University of Louisiana, Lafayette College of Nursing and Allied Health, and member of the South Central Louisiana ONS Chapter, to discuss oncology nursing higher education. Thank you both for joining me today.
Thank you for having us.
Thank you.
To start us off, Joni, tell us a bit about why oncology nurses should consider higher education.
Well, thanks, Stephanie. And my first response to that question is why not? And I think to answer this question, we really need to think about the statistics, cancer statistics of the nursing role in oncology, and also what higher education can provide oncology nurses. I think we're all familiar with the global and the national extent of cancer as the second leading cause of death in the United States, and also aware of some resources that talk about cancer overpassing heart disease as the number one cause of death in wealthy countries. I think we're also familiar with the statistics for cancer survivors, the growing numbers of cancer survivors in the United States, as well as the projected numbers, particularly in an aging population. Second, in terms of the nursing role in oncology nurses play an essential role, a leadership role in assuring quality healthcare outcomes for patients and safety. They also play a leadership role in establishing best practices for oncology nursing, not only for nurses who are work on dedicated cancer settings, but also for all nurses who care for cancer survivors regardless of their clinical setting. I think we've seen a lot of the leadership roles taking play in managing the changes that have occurred recently with our COVID-19 pandemic in the care of oncology patients. So last, what can higher education provide nurses? Well, first of all, it can provide the knowledge, the skills, and the attitudes or values that are essential competencies to assume that leadership role, and providing nurses with a broader perspective to problem solve and make decisions and provide that leadership. When we look at the American Nurses Association scope and standards of practice and standards of professional performance, there's several competencies that are required of nurses, all nurses, pre-licensure nurses, but there are also an additional set of competencies for graduate prepared nurses and for advanced practice nurses. I believe that higher education can provide oncology nurses and help them develop those competencies to meet those needs. All of those competencies certainly reflect strategies to be able to manage the complex cancer care needs.
Thank you. Those were great reasons for us to think about that, and for nurses who are considering higher education to really take some time and think hard about that. Now, Melinda, can you explain the difference to us between a master's, a PhD, and a DNP degree?
Certainly. Thank you, Stephanie. I think before we start talking about differences between master's, PhD, and DNP degrees, we have to remember that those degrees are based on the foundation of a baccalaureate education in nursing. At the baccalaureate level, we prepare a generalist. We prepare someone who's dabbled in some of the specialties perhaps, but not to a great depth. That begins to change at the master's level. At the master's level, that's where we begin to take a deeper dive into aspects of advanced practice. So at the master's level, nurses' choices are to determine what role would they like to pursue in master's education? For example, are you interested in becoming a nurse practitioner? Are you interested in being a CRNA or a nurse midwife or a clinical nurse specialist? Would you prefer the nurse educator track or to become a nurse executive? So again, the first step is to determine a role. The second step is to determine a population focus. If you are going to enroll in one of the advanced practice options at the master's level. For example, if your choice is to become a nurse practitioner, you've selected a role. Now we look at population focus. What population do you want to focus on? Is that psychiatric mental health nursing? Would that be family nurse practitioner? Would it be adult gerontology, or is it women's health? So that's focusing on a specific role, a specific population within the role of nurse practitioner. So then we move on to PhD and DNP degrees. Those are the degrees in nursing at the doctoral level. One is a practice doctorate, and that's the Doctor of Nursing Practice. The other is a research doctorate, the PhD in nursing. The other options today are to not exit at the master's level, but to exit with the terminal degree. For example, there are many programs available where a bachelor's prepared nurse can enroll in a BSN to DNP program. There are also BSN to PhD programs. So the master's competencies are achieved along the way within that program, and there is not an exit at the master's level. Although there are many programs in the U.S. that still exit master's students at the master's level. I'd like to offer to the listeners today, if you're really wanting to see the differences in the expectations of competencies between bachelor's, master's, and doctoral degree programs, what the expected outcomes are of those programs, to look at the American Association of Colleges of Nursing essentials in all of those areas. And those essentials are very explicit in determining what an individual is expected to learn and be competent in by the time they graduate from a bachelor's program, a master's program, and a doctoral program. So I hope that answers the question, Stephanie.
Yes, it really does. And it gives us a lot of information on those different levels of education. What would your advice be for deciding between a PhD and a DNP as a terminal degree for a nurse?
I think the most important delineation between the two roles is what is that individual prepared to do when they exit the program. So the Doctor of Nursing Practice prepares nursing leaders who then can lead interdisciplinary healthcare teams. We prepare DNP graduates to translate evidence and best practices into best practices through nursing research. We prepare our DNP graduates to improve systems of care and to measure outcomes of patient groups and populations and communities. On the other hand, we prepare our PhD graduates to be nursing scientists. And our nurse scientists are those individuals who are generating new knowledge for our discipline. Our nurse scientists are the ones who, if you will, are creating the evidence. And then our DNP graduates are the ones who are translating that evidence and applying them into practice settings, wherever that practice setting may be. So, for example, if you enjoy courses with the objectives of philosophy of science or theory development, advanced research methods, statistics and data analysis, longitudinal and qualitative research methods, PhD program is a program for you. On the other hand, if what excites you is taking deeper dives into evidence-based practice and applying those concepts into a practice setting to affect organizational or systems level change, the practice doctorate is for you, and that would be the DNP.
Thank you. And what great examples right there at the end about the things that you enjoy doing to help you in deciding between those two degrees. What are some additional degrees that our oncology nurses could pursue?
Another great question, Stephanie, but let me add a little bit more to the previous question. People often ask about the requirements for a dissertation at the doctoral level. In a PhD program, dissertation is most often a required component of the program. And in the DNP program, a dissertation is not required, but there is a requirement for a practice project, a synthesis project, an application project in the DNP program. So to answer your current question about what additional degrees an oncology nurse can pursue, at the master's level, there's an option for a clinical nurse leader, which is somewhat of a generalist at the master's level. There's also, of course, the option to pursue degrees that would lead to a nurse executive role. Many programs across the country, including ours, including programs here in Louisiana and our neighboring states, we're beginning to offer a lot more post-baccalaureate and post-graduate certificate programs. For example, those are not full-blown degree programs. You don't earn a degree, you earn a certificate. And those can run anywhere from 9 to 12 credit hours in a concentrated area. So I think nurses will see a lot more options related to post-baccalaureate and postgraduate degrees as an option compared to entering into a master's level or doctoral level program, which include quite a bit more credit hours than 9 to 12 credit hours.
So, Joni, what about the accelerated programs such as RN to MSN or a BSN to DNP program?
Well, Stephanie, the accelerated programs in general really are great opportunities for nurses that really are designed to help overcome many of the traditional barriers that have existed in pursuing higher degrees historically. So not only that RN to MSN or the BSN to DNP, we also work on BSN to PhD. And as Melinda had talked about, the postmaster certificates where you're just aiming for a certain set of competencies that you need, and you're able to develop a nice plan for yourself and to gain that expertise. In general, you think about the accelerated plans as providing nurses with the information that they need to be able to begin a career and make contributions to practice and to society at a much earlier age. So it extends their career contributions.
How have you seen the nursing education evolve throughout your career? We've talked about a lot of different options, and you mentioned at the beginning about nurses, why oncology nurses should consider higher education. But tell us how you've seen this evolve throughout your career.
Well, Stephanie, I think the first thing that comes to my mind is the advances in technology. I think we often talk about how technology in clinical practice has evolved and changed practice. We also have the same thing happening in nursing education from a faculty or an educator perspective. So helping with facilitating teaching learning, facilitating patient care, facilitating communication, and just making the world a smaller place and providing a forum for the exchange of ideas and for problem solving. One example in nursing education, not only in a clinical setting, but in a school of nursing, is the use of simulation. In nursing, we've always had simulation, sometimes pretty low simulations at the beginnings, but there's various forms from high fidelity simulation, virtual simulation, to help nurses transition to practice, whether that be at a beginning level or be an advanced practice level. Also using technology for assessment and testing, and also allowing it to enable folks to participate in higher education programs through distance learning. I began teaching online in 1998, a long time ago, and going back to technology, the advances of technology that have enabled distance education, which is such a popular topic most recently, is outstanding. So the second thing that I think that has evolved is the emphasis and the importance of evidence-based practice, best practices, not only in clinical practice, but also in teaching learning practices, so in teaching strategies. Another one that I mentioned before was the evolution of just minimizing many of the barriers that students face from not only applying and entering a higher education institution, but also continuing and the experiences they have, curriculum and learning experiences they have throughout their career, and graduating in their set of competencies. Another thing that I've seen that has evolved is the emphasis on evidence. Show me the evidence in terms of nursing education and as well as healthcare settings, being very transparent with what are the outcomes of your graduates? How do you show me the evidence that your programs, your interventions, and your curriculum and those things have really enabled graduates to function safely and at a quality level in their role? And then finally, looking at scope and standards. I talked about scope and standards for nurses in practice, the American Nurses Association scope and standards, and the Oncology Nursing Society have scope and standards for beginning oncology nurses and advanced practice nurses. Those things have also grown over the years in terms of not only the faculty role through the National League for Nursing and those competencies, but also the scope and standards for nurses who are educators in clinical settings and who assume roles such as the often called nursing professional development practitioner, or by a variety of staff development, clinical educator roles. So those scope and standards have certainly evolved over the years. One of the things that I needed to mention in terms of evidence, in terms of outcomes, schools need to be even more transparent with program outcomes and publishing the outcomes from all of their stakeholders, gaining input from the learners, input from faculty, input from their employers to be able to tell us how are our graduates performing in their responsibilities in their settings, and helping ease some of the transition and to strengthen the transition and those kinds of collaborative efforts. So those are several ways that I've seen nursing education evolve over my career. And again, technology has facilitated a lot of that in our practice.
You talked about technology, and I think about working in oncology and how quickly treatments change, and just the landscape of healthcare has changed, even just, well, if we're honest, over the last year in light of COVID, with all of the hospitals and institutions having to do a really, really hard turn and go to telemedicine, where they may have thought about it before, but they really, weren't prepared or weren't ready to take that jump that quickly. So in thinking about those kinds of things, and like you said, the advancements in technology and now new treatment changes and things like that, what remains consistent in nursing education, regardless of those things changing as quickly as they are?
Exactly, Stephanie. The basics are good teaching learning practices in nursing education. Those are still important, and also just as much as the sound patient quality care and safety practices in patient care. Another thing that really, unfortunately, hasn't changed that much is that faculty are often asked to keep on including things in a curriculum, no matter at the undergraduate level or graduate level, in an already packed curriculum. So finding very creative ways to be able to integrate key concepts that graduates need to know. Several years ago, we worked with ONS under the leadership of ONS to conduct a study to identify core competencies that are needed in pre-licensure programs and in graduate programs. And feedback from faculty from that national survey not only showed us that there are gaps in cancer care concepts that existed at that time in nursing curricula, but also faculty were overwhelmed with, again, being asked to add more into the curriculum and being asked to maybe sometimes not having access to certain resources to enable them to help provide those opportunities to their students. So I know ONS has that on their strategic plan, has made initiatives in developing a core curriculum, and I know that still is a gap that consistently exists in curricula in the United States. So that needs to have more work contributed to it.
Melinda, I'm going to go back to you now for a question. What are some common misconceptions about higher education in nursing?
There are several misconceptions, I think, after talking with students who are contemplating entering master's and or doctoral programs over the years. And some of those, I think, are common all over the country. And one is that I'm not going to be successful at this. Another is that I'm going to have a hard time juggling a full-time career as a staff nurse or as a nurse leader, along with trying to enroll in a master's or a doctoral program. There are misconceptions related to the length of these programs and misconceptions as to affordability. So I'd like to address specifically each one of those. There are thousands of students enrolled in master's and doctoral programs all over the country, and very few of those in master's programs and DNP programs have taken a leave of absence from their jobs to do this. Most students are indeed working full-time and coming to school full part-time, and a lot of them are coming back to school full-time as well. I think it's a little more difficult to do that in a PhD program. I think most students find it challenging and difficult because of the length and intensity of the PhD programs to continue to work full-time. In terms of cost, I think most prospective students are not aware that many programs have scholarships for graduate students and quite lucrative scholarships for graduate students. And there are other programs may have stipends for their master's students and their doctoral students that help to defray the cost of enrolling in this program, even if you're working full-time. I think one of the biggest misconceptions, though, Stephanie, is that students often come into master's programs thinking that they're going to be able to specialize in a particular specialty area. For example, as an oncology nurse, 10 to 15 years ago, there were quite a few oncology nursing-focused master's programs in the United States. With the adoption of the consensus model for nursing education, advanced practice education, that's not the case anymore. So an oncology nurse is more likely than to have to pick a role, and again, the most heavily populated role in the United States right now is the nurse practitioner role, so I'll focus on that one. And if you recall, I said earlier, the population foci now are limited to family nurse practitioner, adult gerontology, women's health, psychiatric mental health, and acute care nurse practitioner. So you don't hear oncology at all in those options. So we did actually a scoping study of the literature, which was released last year, and we looked at 12 years of oncology nursing related data to try and determine what's out there in terms of educational resources for students related to oncology in undergraduate and graduate programs. And unfortunately, we found very sparse resources in that area. As a matter of fact, only 9 universities that we could find in our review across the entire United States offer oncology-specific academic courses, and that would include certificates or minors or elective options. And of the 9, all but one of those are limited to graduate programs. So we came from a point in time in our history where most of us had oncology nursing electives, or we had an oncology track. And now, according to what we found in our scoping review, what's been published in the literature that we could determine, there are very few of those options available in the United States at this time. Another issue that surfaced as part of this review is that no one has a database related to oncology-related nursing educational resources that an undergraduate student or a graduate student could easily access and determine, okay, where can I get a postmaster's certificate in oncology? Where can I get an elective course in a university in the United States in oncology nursing? So that's another gap that was surfaced by our research.
That's really interesting to find out, but it kind of confirms what I have heard in working with ONS and with some other conferences that are specialty conferences to the oncology specialty, where they're struggling in trying to develop education that is specific to oncology for nurses that have gone back for their MSN or an NP degree and want to practice in oncology, but don't have any oncology experience and did not get that in schools. So that's really interesting that those were the numbers that you found when you did that research.
It was quite eye-opening to us. I can tell you, Joni led this team of researchers, and it was even, more sparse than we anticipated going into the study.
Wow, that's very interesting to know. So, Joni, what are some resources for nurses wanting to explore professional development and higher education that you could give to them?
Well, Stephanie, when I heard this question, I wasn't sure if professional development would be ongoing, continuing nursing education, which is an important aspect and one aspect to develop some of the competencies, but also higher ed. But what came to mind was first in clinical practice, just taking advantage of the professional development opportunities that exist in professional nursing organizations like the Oncology Nursing Society, which is one of the premier organizations. For example, being a member, being an actively engaged member on many of the teams is a lot of leadership development. The conferences, the podcasts such as this one, the books, the journals, the ONS member community posts. I think you just need to look at one day of those posts to see how complex that oncology nursing is and how valuable sharing the ideas and having forums enabled through technology in those communities, how essential they are. And then the online courses and also the financial support for scholarships and grants and things like that. I think the same thing holds true when you look at developing as a nurse educator, again, whether that's in a faculty role or that's in a nursing professional development role. The National League for Nursing, the Professional Nursing Education Group, and then the Association for Nurses and Professional Development. Those professional nursing organizations also have similar opportunities for engagement, conferences, forums, community posts that really help develop the leadership skills of nurses. Another opportunity besides professional nursing organizations is just talking to colleagues who have been through the experience, and also faculty in schools of nursing and other educators, to ask them and have kind of accessing them as mentors to say that maybe they had pursued a certain pathway that they thought, well, now that I am reflecting upon what I did, I would have done this differently, and learn from others, again, through a forum. And then also, I think as Melinda had mentioned before, what their employers provide in terms of continuing education support, in terms of fairs in which schools of nursing often collaborate with healthcare organizations, and just to see what opportunities do exist and to explore those kinds of things. I think a lot of those are just the beginning ideas for resources for nurses to develop professionally and to access higher education.
I think you're right. There's such an importance to remember that professional development, that continuing education that you get is also a big part of that, in addition to higher education, and how that is so important for nurses to remember to help their own personal professional development.
They go hand in hand.
They really do. So, Melinda, I know there are probably a lot of nurses that are listening into our podcast who are thinking about this. And what advice would you have for those nurses who are interested in pursuing additional degrees?
I think the best advice I could give to someone contemplating getting that master's degree or a doctoral degree or a postgraduate certificate is do it now. Don't delay. If you're waiting for the perfect time in your life to be able to do this, trust me, there is no perfect time. I think everyone who's been in a graduate program can tell you that they were perhaps caring for aging family members, perhaps young children, perhaps trying to juggle multiple jobs or multiple projects in their careers. So there's never a perfect time. So if you're waiting for the perfect time to start, that's not realistic and that's not going to happen. I think it's important to realistically, though, consider a career progression or a career development plan. Where do you aspire to be in a year from now, 3 years from now, 5 years from now? What role are you looking to learn more about? A role in clinical practice at the advanced practice level? Is your interest level more on the research side? Is the role more in a leadership management type of role? And then set goals. I think nurses, for the most part, are extremely self-directed and very goal-oriented. And this is another part of your life, part of your career, that goal setting is very important in trying to stay on track with your goals. It doesn't matter, again, what role you're in, whether you want a position in practice or a position in education, in research, or in leadership, you will be competing with others who have either already started this educational process or who have completed that process. We're seeing, because of the access that Joni talked about a few minutes ago, if you want a degree from a university in California and you live in Florida, you're able to do that today. So everyone else is able to do that as well. So remember who you'll be competing against for that coveted position that you have your eye on, and you want to make sure that you're as educationally and as experientially prepared as you can be. So that's some of the most practical advice I can give. The other thing that helps people is starting this journey with a partner. A lot of people like to come into a program, and I did the same thing in my doctoral program and in the master's program. I had a couple of people who were interested in starting at the same time that I was interested in starting, and we stuck together through the programs, and somehow it makes it a little bit easier to have someone who understands exactly what you're going through when you're going through a program. Of course, that doesn't work for everyone. Some people prefer to do it on their own timeline, but sometimes just having that partner who can go through it with you helps quite a bit as well.
So, Joni, what is something about higher education that's not often discussed, but you wish people knew more about?
Well, Stephanie, these are things I was thinking about. It's not that they weren't discussed, not often discussed. They're discussed, but I think there's things that we need to really pay attention to. And Melinda just mentioned one of them, and one was developing a professional development plan. I think when you're faculty in a school of nursing, you're so accustomed to having very structured tenure promotion processes, evaluations, and jotting down everything that you've done and having to provide that evidence every year. And I taught in all levels in schools of nursing, and currently in the master's program, when I have students develop a professional development plan like Melinda talked about, it seems that it's something that's uncommon, not familiar to them, that they may have heard about it, but they've never developed it. And to understand that it's important to know where you're going to be. Don't you want to have goals for at least the next year? What are the baby steps you need to take to get towards those goals, whether that's seeking education, another degree, seeking certification, or even continuing education. I often talk about the fact that it's not just necessarily one dimension. For example, my background's in nursing education and in oncology, and trying to integrate those two together in a plan to say, how am I going to remain competent in practice or be familiar in oncology, and how am I going to maintain nursing education? But just taking steps to develop that plan and kind of pursue that. The other thing that I thought about that, again, has been addressed, and fortunately or unfortunately addressed more in the recent news, is one of the competencies of all nurses is providing culturally congruent care. And we've heard of a lot of words about the vulnerable populations, marginalized individuals, the underserved, and being very aware of terms practices such as implicit bias, stereotypes, prejudice, discrimination. Just that those concepts have always been important, but need to be even more important now, not only in clinical practice, but in teaching, learning, and all avenues of life. So I think those might be the two things that I think are areas that we need to emphasize again.
Well, thank you both. This has been very enlightening. And you both have just given us a wealth of information. And for those who are listening and contemplating higher education and going back to school, you've given us a lot of good tips and resources and things to think about. Do you have any final comments for us today?
I do. Thank you for asking us to kind of wrap this up in a final summary. I know from my perspective, what drives me is doing the best that we can for our patients. And I just read recently, earlier this month, that for the 19th year in a row, that nurses have been regarded by the public as the most ethical and most trustworthy profession. The other thing that we know is that the more education a nurse has, the better the outcome for the patient. That's irrefutable. That's been proven over and over again for now over a decade, and it's been proven not just in the United States in multiple settings, but in multiple countries across the globe. So if we're going to give the best care that we can give to our oncology patients, it behooves us to remain educated, to get educated, to be lifelong learners, and to truly every day learn more about the changes that are happening that our patients are experiencing to make a better quality of care and a better quality of life for our oncology patients and their families.
And Stephanie, just one couple final thoughts. I think we've already discussed how complex oncology nursing is and the leadership role that the oncology nurse plays, not only in oncology nursing, but in helping other nurses understand the needs and the care of cancer survivors. And 2020 was the year of the nurse and midwife. I think we all need to continue to live up to those standards in oncology nursing and continue to have every year be the year of the nurse. Thank you.
And it's never too late to start.
That's right.
It's never too late. I think Joni and I both know people who started doctoral programs when they're in their 60s. So it's really never too late to start.
Well, thank you both.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.